In the next 10 minutes, we shift to Rajasthan with Sonu Pareek. She's a research fellow at Social and Policy Research Center, Jaipur. Floor is yours.
I'm presenting on behalf of Dr. Manish Tiwari, which we both have worked together. It's a title of Determination of Workforce Availability. Determination of workforce availability for performance and specialist and general duty for medical officers. Introduction of the study is that the health sector in India faces several challenges like the lack of health workers, doctors, female workers, particularly in unserved and underserved area. There is an urgent need of assessing the gap between the services expected and provided. There is also a need to evaluate the prevailing scenario of the health system, including the availability of medical manpower, the human resources related issues like the recruitment, compensation, transfer, training policy of medical officers, etc. Objective of the study is that study of the process of recruitment and deployment of doctors, especially in the underserved and unserved areas. Study workforce management issues such as posting, transfer, promotions, training, appraisals, grievances, handling. Compensation package of incentives provided to attract the medical officers and specialists of rural areas. Analyze the gap in the support system, which included provision of on-campus facilities, promotion and supportive supervision. Review the educational and training program for enhancing the capacity of doctors and suggested a revised strategy if required. Access the gap between the services expected and provided, and recommend a capacity building process of optimizing efficiency and effectiveness of the doctors to conduct the situation analysis of the existing facilities, number of facilities required to staff required. Now we are coming on methodology. On the basis of the discussion of NHRC and the state health department for districts were selected on 4. It's a HDI, criteria of HDI, it's one of Jhalawad, it's a high HDI, Bikaner and Siro, it's a medium HDI, and last is Bharatpur, it's low HDI. The institutions surveyed in 4 districts were district hospitals, CSC and the PSCs, then interviewed the doctor using pre-designed and pre-tested performer. Finding of the studies, the essential physical facilities were available in all the district hospitals. At most of CSC were lacking at the PSCs. The essential equipments were available at all the district hospitals but insufficient at the CSC and PSCs. Several positions of a generalist and specialist were laying vacant. The number of experienced doctors was only 1/3 and only 18 were lady doctors. A large number of doctors employed in the public health systems hailed from rural background and expressed an inclination towards receiving specialization trainings. The doctors were not satisfied with their first place of posting. Further, the medical personnel were found not being treated equally in terms of transfers, and reasonably high degree of dissatisfaction was found among the doctors in terms of their remuneration, as it is not accordance with their qualification and length of services. Regarding the availability of workspace, instrument and drugs, supporting staff, logistic and community supports, the specialists were found to be satisfied, but 1/3 generalists were not satisfied. The level of satisfaction of each facility was found to be a varying percentage. The interviewed doctors were found to be unsatisfied with educational facilities for their children. It is concluding that posting perception regarding specialization, hierarchical satisfaction, quality of facilities and services, and human resource policies are the determinants of workforce availability. The discussion of that increase and improved facilities must be provided to the doctors so that they can be retained. Even the quality of services must be improved in order to move step by step in desired direction. There is a need of sound HR policy and its better planning management. This is included transparency in deployment, transfer and promotions. It will even be helpful for better recognition of roles and responsibilities for the doctors. Ways to motivate young doctors must be included, like make loan for medical education easier for students willing to go for the PSc in difficult areas. There should be a flexible hour for work for women doctors. Skill of our nurses and paramedical staff need to be improved by training. Regular induction and in-services training program are the required. There is a need to strengthen medical college and nursing schools. Policy maker of the state need to examine the fact deeply and thoroughly by seeking the expertise of professionals who have been associated with both the end of the health system. Coordination, communication between the two is also required. Thank you.
Thank you. Thank you, Sonu, not at least for keeping more than time.